Hello, my name is Dominique, and today I'll be talking to you about my research with the Ontario Veterinary College and the Animal Health Laboratory about astroviruses and their role in bovine neurologic disease. So neurologic diseases in cattle occur due to inflammation of the brain, which we often call encephalitis. These diseases can cause significant morbidity and mortality, and are associated most often with clinical signs such as circling, paddling, incoordination or staggering, and seizures. They can also present a risk to human health and can lead to animals being excluded from the food chain. So it's important to understand what agents can cause these conditions to better prevent, diagnose, and even potentially treat them. In young animals like calves, we most commonly see inflammation of the brain following an umbilical infection, particularly with the gram-negative bacteria such as E. coli. But viruses can also cause disease in these young animals. In adult cattle, which were the focus of our study, there are numerous potential causes for inflammation of the brain, ranging from bacterial infections such as Listeria, metabolic disturbances or toxin exposure such as lead, as well as various viral infections. And despite what we currently know about the causes of inflammation of the brain, many cases do test negative for known causes and don't ever end up with a definitive diagnosis. Understanding what causative agents are present in Ontario, including identifying novel agents that we haven't been testing for previously, will improve our ability to diagnose these cases. A diagnosis brings us closer to being able to prevent or even treat these cases, and as well, a definitive diagnosis allows us to take steps to help protect the other animals in a herd, as well as people who may have been exposed to this animal. One novel agent recently described in cases of brain inflammation is Astrovirus. This virus has been associated for years with sporadic intestinal disease in young animals. More recently, this virus was found as an emerging cause of brain inflammation in humans. And since then, the bovine strain has been demonstrated in various cattle populations around the globe, including Ontario. For our study, we wanted to investigate the role of astrovirus in inflammatory brain disease here in Ontario cattle. We searched the Ontario Veterinary College and the Animal Health Lab database to find archived cases of suspect viral brain inflammation, which did not end up with a definitive diagnosis. And we can identify these suspect cases for viral infection based on the type of inflammation present in the brain. And once these cases were selected, we tested archived tissue by PCR to look for genetic material consistent with astrovirus. So these two tables outline the results of our study. Table 1 shows the results of our astrovirus PCR testing, and as you can see, alongside our cases, we also had two control groups. The first control group was composed of animals that had a form of brain inflammation that wasn't viral in origin, and the second control group was composed of animals that didn't have inflammation in the brain at all. Out of our suspect viral cases, 4 of them did test positive for astrovirus, and no animal in either control group tested positive. In Table 2, we just have some details about those 4 positive cases. Going back through the archive, the oldest case that we found was from 2014, and all of our cases were from Southern Ontario, particularly the Southwest. We had a range of ages affected from 7 months to 7 years old. We had a mix of beef and dairy breeds represented, and in our particular case, the majority of the animals were male. A variety of clinical signs were reported from these infections. Most commonly, staggering or difficulty walking was seen. So the results of our PCR testing indicate that astrovirus is a cause of sporadic brain disease in Ontario cattle, and it should be considered as a potential diagnosis in cases of brain inflammation. These cases are important as a cause of morbidity and mortality, and being able to rapidly as well as accurately diagnose these conditions is essential to maintaining both animal and human safety, as well as profitability. Additional investigation of these cases will help further our understanding of best practices for diagnosis of this disease and aid in disease surveillance in Ontario cattle. Funding from the Ontario Ministry of Agriculture, Food and Rural Affairs through the Ontario Agri-Food Innovation Alliance is gratefully acknowledged. Thank you so much for your attention to my presentation, and I hope you enjoy the rest of the conference.